Welcome to the Real GI Doc Show. I'm your host, Dr. Fred Gandolfo, and I'm a board-certified gastroenterologist with a medical practice in New York. On today's episode, I am going to discuss a common and often deadly liver disease related to drinking excess alcohol, called alcoholic hepatitis. I will review a case of a patient with alcoholic hepatitis that ends tragically, and we'll discuss the risk factors related to the development of this disease, including how much alcohol one has to drink to get alcoholic hepatitis. I'll also review the symptoms to watch out for and some treatment and other factors that could potentially help or harm a patient with alcohol-related liver disease. Now, before we start, I have to tell you that the following presentation is based on a real patient case. Some details have been changed to protect patient privacy. So this case is a 43-year-old woman who came to the hospital complaining of fatigue, abdominal pain, and jaundice for about 3 to 4 weeks. Jaundice, if you didn't know, is when your skin starts to turn yellow. So she recently lost about 10 pounds due to a very poor appetite. She states that she started drinking alcohol in her 20s, but over the past 5 to 6 years, her intake has increased somewhat, and she was drinking at least 4 to 5 glasses of wine per night, sometimes more than that. She stopped drinking about 2 weeks ago when she noticed that her skin was getting yellow, and overall she just felt very poorly, with lots of malaise and fatigue. She also complains of poor sleep, and frequently her skin feels itchy. We reviewed the past medical history, and she had none. She takes no medications, including no over-the-counter medications. She has no family history of major health issues, including cancer or liver diseases. Her social history: she is single, she has no children, she works as a teaching assistant at a local high school, and she does not smoke cigarettes or use any illicit drugs. So when I see a person presenting with these issues who drinks a significant amount of alcohol, that moves up to the top of the list of problems that I have to look for. So to formulate a differential diagnosis, meaning all the things that this might be that we have to now rule out, alcohol-related liver disease is right at the top of the list. And that includes alcoholic hepatitis, fatty liver from alcohol, alcohol cirrhosis, and other liver diseases. We look for hepatitis B, hepatitis C, a myriad of other liver diseases that are kind of beyond the scope of this discussion, but we send off a whole panel of blood work for all different metabolic liver diseases. We also check out the liver in terms of imaging, looking for gallstones, and we look for malignancy, cancer, medication side effects, of which she's taking none. We ask about recent antibiotic use and other things like that, over-the-counters, NSAIDs, Tylenol, Motrin, Advil, herbals, but she's not doing any of that stuff. And also infections and other generalized health conditions that we also screen for and think about in a differential diagnosis of someone who has a major organ dysfunction. But for her, basically we focused on alcohol because that seemed to be the smoking gun. So the physical exam: she was deeply jaundiced, her skin was dark and deep yellow colored, and she was otherwise in no acute distress. She was 5'3" in height, her weight 120 pounds, her blood pressure 100/60, her heart rate 105, and she had no fever. The examination of her eyes showed icterus, which is a yellowing of the normally white part of your eyes, and her abdomen was mildly distended. She had a little bit of tenderness in the right upper quadrant of her abdomen, which is the area where the liver is located, but she had no obvious ascites, meaning no obvious fluid in the belly, and she had no peripheral edema, meaning her legs were not swollen. She also did not have any asterixis, which is a flapping tremor you can develop when you have liver failure, and she had no confusion, but her affect was somewhat flat and blunted, which is often seen with depression. In terms of lab work, her white blood cell count was 11, just above normal. Her hemoglobin, which is the red blood cell mass, was a little bit low at 10.4, and her platelet count was low at 95. In terms of liver enzymes, her AST was 99, her ALT was 38, her total bilirubin was 28, which is very high, and that's responsible for causing that yellowing of the skin called jaundice. Her albumin, which is the main protein in your blood, was 3.1, And the INR, which is a measure of her blood clotting, was 1.3, which is a little elevated. The remainder of the labs related to liver disease, including hepatitis serologies and other labs, were negative, meaning normal. Some imaging was performed. We started with a sonogram and then eventually a CAT scan. And they both showed the same thing. They showed hepatomegaly, meaning her liver was larger than it should be. And it was quite massive, actually. It was quite swollen. And trace ascites, meaning a little tiny bit of fluid in the abdominal cavity that shouldn't be there, but not enough to really appreciate on physical exam. Furthermore, she had no biliary dilation and no gallstones, so there was no blockage anywhere in the biliary tract that was responsible for causing her to turn yellow. So after looking at the differential diagnosis, the diagnosis that made the most sense is alcoholic hepatitis. So let's talk about alcoholic hepatitis a little bit and focus on how it happens and who it happens to and what the treatment is. And then we'll move back to our patient and talk about what happened to her. So alcoholic hepatitis is the term for a severe alcohol-related injury of the liver. And basically what happens is you have to drink a fair amount of alcohol to develop alcoholic hepatitis. And it's an acute inflammatory syndrome where patients become jaundiced, they turn yellow, and they have necroinflammatory liver disease. The cells in the liver are inflamed, the cells in the liver die from the inflammation, and liver injury occurs. And this has a spectrum. It can be mild, which is very common, or it could be moderate or severe, which is often fatal. So we'll talk all about this. The prevalence of alcoholic hepatitis is actually going up, and even before the pandemic, the COVID-19 pandemic, the alcohol-related liver issues in the country were going up. But since the pandemic, alcohol-related liver disease has exploded with a 53% increase from 2019 to 2020. And people are saying a 64% increase during the later phase of the pandemic, which I guess we're coming out of that now, but there's still been quite a bit of alcohol-related problems that came from the pandemic and are still carrying forward today. And I'm seeing this in the office and in the hospital. There's a ton of alcohol-related liver disease problems, much more than I was used to seeing even just a few years ago. So what's the real prevalence of this disease? It's really not entirely known because not all these cases get reported, only the severe ones do. But looking at some more recent data, about 125,000 people were hospitalized with alcohol-related hepatitis in 2019. And again, it's probably much more than that. And a lot of people who have alcoholic hepatitis never make it to the hospital or don't go to the hospital. And some of them get lucky at home and they get better and they stop drinking, and some of them don't get lucky. So that number, 125,000 in the country, is probably an underestimate, but it's still a fair amount of people. So what's the risk of alcoholic hepatitis? I mean, the main risk is that you can die from it. So mortality or death with an episode of alcohol-related hepatitis is pretty significant. It's about 15% of people will die from this at 30 days after diagnosis. And after about 1 year, that number jumps up to about 40% of people. So if you have severe alcohol-related hepatitis, your chance of being alive 1 year later is only 60%. Not the greatest statistics. And although there is treatment available, the treatment does not improve those numbers that much. So the big question is, how much alcohol does it really take to cause so much inflammation in your liver that you develop alcoholic hepatitis and that associated 40% mortality at 1 year? Well, it's a surprisingly large amount, but also not that much. And again, it's different based on individual factors. So there's many individual factors that will determine if someone's at risk of developing alcoholic hepatitis. And different people can drink the same amount of alcohol, and some will develop alcohol-related liver diseases, and some will not. And it's not entirely understood as to why that happens, but there's a few things that we can talk about that make it interesting. So the average drink, or the standard drink, I should say, contains about 14 grams of alcohol. That's pure alcohol. The rest is water and other things, but 14 grams of pure alcohol in a standard drink. And a standard drink doesn't mean a gigantic glass of wine that you get at a restaurant or that you pour yourself at home or some nebulous amount of alcohol that you put into a mixed drink. A standard drink is actually a measured out amount. So a 12-ounce beer that has 5% alcohol, that's one standard drink, 14 grams of alcohol. The same is a 5-ounce glass of wine. One 5-ounce glass of wine that has about 5% alcohol in it that contains 14 grams of alcohol. That's one standard drink. A bottle of wine is about 750 mLs, and that's the same thing as 25 ounces. So that contains 5 standard glasses of wine. Now, if you split a bottle of alcohol with a friend over dinner, you often each get about 2 glasses. So those glasses are a little bigger than the standard glasses. So they're a little more than just the 14 grams of alcohol in our standard drink. And if you drink an entire bottle of wine by yourself, you drank about 70 grams of alcohol. That's 5 standard drinks at 14 grams each. And the same is for a standard shot of 80 proof liquor. So 1.5 ounces is the standard shot size. A lot of people pour a shot that's double that size, but 1.5 ounces is a standard single shot size, and that's 14 grams of pure alcohol. So if we look at the amount of alcohol that people say it takes to cause alcoholic liver disease, especially alcoholic hepatitis, which is the more severe acute form of alcohol-related liver disease that we're talking about today, it can be seen in women who consume more than 40 grams of alcohol a day. That's like the bare minimum alcohol that you have to take in to get alcohol-related liver disease or alcoholic hepatitis, 40 grams a day. Now, if you think about it, that's only about 3 glasses of wine. It's a little less than that, actually. Or 3 beers. It's not a ton of alcohol. In men, there's a little more leeway, about 60 grams a day of alcohol. So that is the same, though. If you drink a bottle of wine as a guy, or if you have a 6-pack, you're in the range where you can develop alcohol-related liver disease. And that's like the bare minimum that people say you have to take in pretty much daily for about 6 months. So if someone goes on a binge of alcohol and they're having a bad time, or whatever happened socially, or they lost a loved one, or they lost their job, or whatever happened, and they go on one of these benders and they're drinking tons of alcohol for even just a few months, if you're drinking enough, and if you're drinking it for long enough, you can develop acute alcohol-related liver disease with a 40% mortality. So you can really throw your liver away very quickly by drinking too much too fast. Now, most people who develop alcohol-related liver disease, or the majority of people who develop alcoholic hepatitis, they consume more than that. They consume about 100 grams per day of alcohol, so 100 grams a day. So that's a lot more than just the standard, 2-3 glasses of wine that a lot of people drink. Even though that amount is often a problem, it's not anywhere near 100 grams of alcohol a day. 100 grams is about 7 drinks. So if you drink a bottle and a half of wine yourself, or if you drink a whole bunch of mixed drinks, or you take a whole bunch of shots, you're in that 7 drink category. And that's enough for most people to cause alcoholic hepatitis. Now, it varies based on your body weight, it varies based on your nutritional status, and it varies based on other health factors, including genetic factors. So a couple of things that have to do with how risky it is to drink a lot of alcohol. It really depends on also what you're drinking. Even though all these standard drinks contain the same amount of alcohol, people who drink liquor, as well as people who drink beer, in the studies, they seem to develop alcoholic hepatitis more. And maybe that's just because the patterns of people who drink those drinks are maybe different than the person who's drinking wine, but it's unclear as to why that is. Binge drinking, as well as drinking outside of the typical meal times, is also associated with a higher risk of developing alcoholic liver disease, which also makes sense. So if you're drinking a ton of alcohol at a time, binge drinking, or if you're drinking outside of traditional societal times where people drink, which is around meal times, meaning like you're going out drinking, that often leads to excess drinking, and the excess drinking leads to alcoholic liver disease. So that makes some sense there. With men and women, there's definitely a lot of variability. Men have a little more leeway in terms of how their liver processes alcohol. Men are often a little higher body weight, and they have potentially a better capacity to tolerate alcoholic liver damage than women do. And that's the general rule. Men and women both suffer from alcoholic liver disease for sure. Men tend to drink more than women do, so it kind of catches up to you. It's kind of proportional. But there's definitely a difference, meaning women are a little more susceptible and can get alcoholic liver disease with less alcohol, according to all the studies. The number of women also succumbing to alcohol-related liver disease is accelerating. So as the years go on, especially with the pandemic, but currently as well, the risk of a woman coming in with alcoholic liver disease into the hospital or into the office is going up. More women are drinking more, and more women are succumbing to alcoholic liver diseases than they used to be several years ago, and that's not a great trend that we want to see. So nutritional status is a huge component of how people do in terms of how they handle alcohol and if they develop alcohol-related liver disease. And some of this is because your liver processes your nutrition and your liver processes alcohol also. And if you don't have a good nutritional status, meaning you are calorie deprived or you're protein deprived and you're not eating regularly, you're not eating well, or if you're substituting food for alcohol or vice versa, however you want to say that, but if you're drinking instead of eating, that is a big no-no in terms of the way your body's going to handle alcohol. And you are at much higher risk of developing alcohol-related hepatitis, alcohol-related liver diseases, if you have a poor protein intake, a poor calorie intake, or if you're taking in poor quality foods like a bunch of processed junk food carbs and drinking just alcohol and not getting any of those essential vitamins and other things that you get from eating healthy food. So mortality and the onset of alcoholic liver disease has been linked to protein poor diets and to calorie poor diets and to choosing alcohol instead of food. So women are more susceptible to this also because they often have less of a nutritional reserve, meaning that there's less of a fat reserve and maybe less of a protein reserve in the body because of less muscle mass on average. And that is often why it takes less alcohol over a shorter period of time to cause alcoholic hepatitis in a woman. So women should be especially aware of this disease and realize that even with just 3 to 4 glasses of wine a night, in some people who may have genetic susceptibility and poor nutritional status and low body weight and who are, quote, going out drinking and not really eating, that is a big risk factor to developing alcoholic liver disease if you do it long enough. And I've seen plenty of people in the hospital who are otherwise young and healthy who turn yellow, and it's quite a scary thing. And once that's happened, you have a disease for life now. Your liver has problems for life. So what else can we look at in terms of nutritional status? There's some vitamin deficiencies, such as if you're depleted in vitamin A, vitamin E, or zinc, that can also cause problems with your liver in terms of detoxifying it. So it's not able to kind of heal itself if you have no vitamins, and that kind of correlates to your nutritional status as well. Now, I'm not saying go drink your face off and supplement yourself with vitamins and protein, but if you do drink heavily, or if you know someone who drinks heavily, at least they should be taking some vitamins and trying to get some lean proteins and trying to cut back on the alcohol as well, because the nutritional status really does play a role in the development of alcoholic liver disease. Now, you can do this to the extreme. You can take in so many calories that you are becoming obese and developing diabetes and metabolic syndrome and non-alcoholic fatty liver changes that you can get from just overabundance of calories and obesity. And that's really bad for your liver also when combined with alcohol. So if you're malnourished, it's terrible, and you develop alcohol-related hepatitis. And if you are overnourished and have fatty liver at baseline from non-alcoholic risk factors like obesity and metabolic syndrome and diabetes, which is the traditional non-alcoholic fatty liver triad, then and you drink alcohol, that is like adding gasoline to the fire. And people who have metabolic syndrome with steatohepatitis already and then drink alcohol on top of it, it's like a synergistic effect, and they can get very bad liver damage very quickly. So those two things really fuel each other. That is, the regular fatty liver from obesity and diabetes and metabolic syndrome plus alcohol is a bad combo. So if you're drinking a lot, you want to eat enough, you want to eat healthy, you don't want to eat junk and cause yourself even more harm at the extremes of either malnutrition or overnutrition. So next, I'd like to just review how alcohol gets broken down by the liver and how it causes damage in the body, because it's a poison to your liver, but how does it actually poison the liver? It's interesting how it actually happens. There's a few different ways that alcohol is bad for your liver. And I should mention that basically every single way that alcohol gets metabolized in your body is detrimental to your liver and GI tract. So there's many different pathways, and it's actually amazing how all these different pathways all combine to cause damage. It's not like there's just one way that alcohol gets metabolized and causes an issue. There's actually like many different ways, and they all cause issues. So it's surprisingly toxic, I should say. It's like designed to be a liver toxin. And if it didn't make you feel good and have other fun properties, it really would just be classified as a poison and would be like something that you would clean your windows with and not actually drink. But it's not. So alcohol gets broken down. You drink alcohol, it goes into your stomach, you absorb it into your bloodstream, and it basically goes right to the liver through the portal system and also right through the blood, and gets to the liver and gets broken down by enzymes there. So the first step in your liver in terms of detoxifying alcohol is that there's an enzyme called alcohol dehydrogenase, and that breaks down alcohol into a substance called acetaldehyde. And acetaldehyde is like this intermediate byproduct of the breakdown of alcohol. And it is toxic. It is a poison, and it's not good. So you have a secondary enzymatic reaction with an enzyme called aldehyde dehydrogenase, and that breaks down acetaldehyde, which is toxic, into this non-toxic substance called acetate. And acetate can enter into the energy cycle of your cells and can be made into energy and calories, and it fuels metabolism. It's not the best way to get your nutrition through drinking, but alcohol does have calories, and you drink alcohol, it gets broken down to acetate eventually. And eventually that gets broken down to carbon dioxide and water, like everything else. And that acetate, when you have acetate in your blood, you can kind of smell that fruity drinking, that kind of gross but fruity drinking smell on people's breath. And there's other substances that do that also. But that's basically the main metabolism of alcohol in your liver. And acetaldehyde is that toxic intermediary. And what it does is it damages your liver cells directly by damaging proteins and damaging the fats that are inside of your cells naturally and damaging the DNA in your liver cells. There's another enzyme that breaks down alcohol when you drink too much alcohol. So the regular aldehyde and alcohol dehydrogenase pathway breaks down alcohol when you're drinking some alcohol. But if you drink a lot of alcohol and that pathway can't keep up with the breakdown, then there's a secondary like overflow mechanism where some of the cytochrome enzymes in your liver will break down alcohol directly, and they will cause these reactive oxygen species to develop. And these are like ugly molecules that are highly reactive and will destroy and damage parts of your cells. They'll damage the liver cells directly. They can cause cell necrosis, meaning cell death, and they'll also damage DNA and damage proteins inside of your liver cells. And all that leads to inflammation and dead liver cells and scarring and all kinds of other problems over time. Additionally, fatty infiltration in the liver as a result of too much alcohol can increase your gut permeability. And what happens is you can get leakage of these things called lipopolysaccharides, which are like normal parts of bacteria that live inside your gut. They can leak through the normally tight junctions between the cells in your intestines, and they can leak into the portal circulation, and you can get endotoxin, which is part of these bacterial cells, into the portal system, and that will also cause more inflammation in the liver and cause activation of these cells that can release other inflammatory factors like TNF-alpha, which is not great. It's a very inflammatory cytokine, or it's a very inflammatory substance that your body makes for all different diseases. But what happens is you get elevated inflammation in your liver. These Kupffer cells release TNF-alpha, and you get more hepatocyte injury and death, and all kinds of other systemic inflammatory responses, meaning it's a total body inflammatory response. And this is why you see people who are suffering from alcohol-related liver disease, they start to become a little cachectic, meaning they stop eating, they feel sick, they feel malaise and tired and fatigued. It's because they have these ugly cytokines in their system, as if they're fighting the flu or cancer or some other, total body inflammatory problem. So this comes up later when we talk about nutrition in liver disease. And the best thing you can do for someone who has alcohol-related hepatitis is to feed them. You need to feed them protein and calories. And the last thing their body wants to do, because these inflammatory cytokines are so high, is the last thing they want to do is eat. They feel sick. They feel like they're dying, and they are dying. But their body is telling them, don't eat. Everything's shutting down. And all they have to do is eat to get better. And it's a really big problem because it's very hard to force feed an adult human being. It's very risky, and it's not what anyone likes to do. So that's the bottom line in terms of pathogenesis of alcohol-related hepatitis. So you have the main enzymatic pathway, which releases acetaldehyde, which is poison, and that damages cells. You have this overflow pathway, which also releases these reactive oxygen molecules that destroy things directly. And then you have this leaky gut thing that happens where you develop endotoxin in your portal system that also makes its way back to your liver and causes inflammation and causes increased inflammatory cytokines in your entire body. And I like to use that term leaky gut here because it actually does apply. This is actually real leaky gut. One day I'll do an episode on leaky gut, which is the internet leaky gut that you hear about that causes all kinds of problems, and it's mostly just a made-up internet term. But patients love that term, and sometimes it actually is a real thing. There's many diseases that actually do cause this, quote, leaky gut phenomenon, and alcoholic liver disease is one of them. amongst other things that we can talk about in the future. But it's often a term that's thrown around with no real meaning. But in this case, it actually does apply. You get leaky gut. So there it is. You heard me say it. So what do people look like who develop alcoholic hepatitis? Very briefly, they're easy to spot because they turn yellow. The biggest thing that happens is they get jaundice, their eyes turn yellow, their skin turns yellow, and they look like very sick. They develop what's called sarcopenia, meaning that their muscle mass is decreased because of this total body inflammation and poor nutrition and drinking lots of alcohol instead of eating. So they look frail, they become jaundiced, they look sick, they act sick, they're fatigued, they develop generalized and often right upper quadrant abdominal tenderness and pain. They have an enlarged liver that you can kind of feel if you push on their belly. Sometimes their spleen can get enlarged. And eventually, over time, if the disease gets bad enough, they start to build up fluid in their extremities, fluid in their belly, fluid in their legs, and they look like they're becoming end stage with liver disease. And when you get really bad into it, you start to develop mental status changes, confusion. You can have a flapping tremor called asterixis that you can demonstrate at the bedside, and that goes along with the liver not functioning anymore and not breaking down toxins in your blood, including ammonia, which builds up and causes all these mental status changes, including coma and eventually death. So what do we see on labs? The hallmark thing that you see, like we saw in our patient here, is the bilirubin goes up, and that's what turns you yellow. So the bilirubin goes up rapidly, and the liver enzymes also rise, but not anywhere near as much proportionally as the bilirubin. And the big characteristic here is that the AST to ALT ratio is greater than 2 and often greater than 3 to 1, meaning that your AST, one of your liver enzymes, maybe it goes up to 250 and your ALT only goes up to like 100. That's a common ratio in alcoholic liver disease. And that's one of those giveaways that alcohol is probably the source of the problem. So let's touch on the treatment of alcoholic liver disease and alcoholic hepatitis specifically, and then we'll go back to our patient and talk about what we tried to do and what actually happened, because it's an interesting and sad story. But the treatment for alcohol-related liver disease in general is really alcohol abstinence. So no drinking at all. That's the treatment. Cutting back doesn't do it. I guess it's okay to cut back. It's better than drinking more, but it's not enough. It's too little. It's too late. The liver's already on fire. And cutting back does not put the fire out. It just kind of slows the fire down. So you really have to stop completely, which sometimes is dangerous. And often these people are in the hospital because of their alcoholic hepatitis and because they're basically dying, and they're in the hospital and they often have to go through a withdrawal from alcohol in a medically supervised setting and have to get drugs to treat that withdrawal, because the withdrawal from alcohol could be quite dangerous. You could develop seizures and other problems. And it has to be monitored medically. You have to treat it with benzodiazepines and other medications. So alcohol abstinence is the foundation of the treatment. And if you did a liver biopsy on someone after about 2 weeks of alcohol abstinence, meaning no drinking at all, you can actually begin to see changes in the cells for the better. So you'll see some improvement on the biopsy, even in just 2 weeks of not drinking. But the improvement in your liver cells can actually take a year to a year and a half to fully manifest. Meaning, if you stop drinking today, that you might not see the full benefit of that on your liver, meaning your liver can heal itself to a certain point, and it can take about a year to a year and a half. So people get discouraged when they stop drinking and they still kind of have problems. Their liver enzymes are up. They still don't feel great, all these things, but that can take so long to manifest. So you have to assess this thing in the outpatient setting. We assess it month to month, every few months, and eventually I like to look back after a year or so when someone stopped drinking and say, hey, look, here are your numbers now. Everything basically went back to normal. Your liver looks much better on imaging. It often doesn't go back to normal, but you can live with this, where if you were still drinking, you would either be dead or you'd still have a bilirubin of 30, and that's a terrible situation. It's not going to get better from there. So it's a slow progress, and it starts to happen very quickly. So stopping drinking right away is the most important thing, but it could take a year to a year and a half to really fully manifest that healing process. And then there's nutritional supplementation. So nutritional supplementation still is part of like the hallmark of the treatment that you do for alcoholic liver disease. And really it's getting enough calories in someone's body and getting enough protein in their body. So at least 2,000 calories a day and at least 1.5 grams of protein per kilogram per day is what's recommended for alcoholic liver disease. Now for a, quote, standard 70 kilogram man, which equates to about 154 pounds, that equals about 105 grams of protein a day. So it's a fair amount of protein to choke down when you're sick and don't feel well. But it's necessary. And we often recommend, especially in the hospital, protein supplements, protein shakes, nocturnal feeding, meaning you wake someone up, right before they go to bed, they kind of slam down a protein shake, and sometimes even snacks between meals. So you get your 3 square meals a day. And between those meals, you try to drink a protein shake or something. So you're constantly feeding yourself protein. Super important to help the liver heal itself is to give protein, which is fuel. So for a woman, a 54 kilogram woman, that's about 82 grams of protein. That's equivalent to like a 120-pound woman. And these things can go up and down based on your body weight, but you really are trying to get in somewhere between 80, 105, 110, 120 grams of protein a day. It's a fair amount of protein. So as close to that as you can get, and it's based on body weight. So that's nutrition, and that's alcohol abstinence as treatment. Basic stuff, hard to do sometimes, but you get the most bang from your buck from those two things. And then what about when someone has severe alcoholic hepatitis? There's a scale that we use. We can calculate out a scale. I'm not going to go into it now because it's boring unless you really are a gastroenterologist, and then you already know it, so I don't have to talk about it. But there's a scale we use to see like what someone's risk of dying is from this alcoholic liver disease. And if they rate high on this scale, then we treat them with steroids. And many things have been tried for alcoholic hepatitis before, and most of these drugs don't work, except steroids are the only one that continues to show a benefit over the years. And the benefit is not amazing. If you decide that someone has a high mortality risk from alcoholic liver disease and you want to treat them with steroids, you only improve their survival by about 15% in the short term, meaning in the first 30 days or so. If you don't treat them with steroids, they have a 15% higher chance of dying. If you do treat people with steroids, they have about an 80% survival rate in the first roughly 30 days, where if you don't treat them with steroids, they have about a 65% survival in the first 30 days. So it's an improvement in their survival of about 15%. It's not a huge number, but if you're one of those 15%, you're pretty happy that you took the steroids. Now, that's only after, I say 30 days, really the 28 days is what they use in the trials, but that's kind of dorky. So it's 30 days. But the other fact here is that there's no real mortality benefit after a year. So it gets you through that first little hump of the first 28 days giving the steroids in 15% of people. But after that, there's really no difference. So if you had such severe liver disease that you were going to die, or that you go back to drinking or whatever, you don't eat enough or whatever happens, it's a short-term benefit from steroids. It gets you over that hump. But if you have to keep doing things to get better. You have to stop drinking, you have to eat, you have to take care of yourself. And even then, there's no guarantee that you're going to improve, but that's your best chance of survival. So steroids just get you there they just keep you alive for the first month. And there's really, after about a year, there's really no benefit in people who took steroids or didn't take steroids in terms of mortality. So it's a little scary. But steroids work by blunting the immune response. They are anti-inflammatory. So all these horrible inflammatory substances that your body secretes in terms of the liver damage that's happening that we just talked about, the steroids will kind of blunt some of that mechanism and slow down the damage and potentially get you through that first 30 days. And then ultimately, the ultimate treatment for alcoholic hepatitis with liver failure is liver transplant. And it used to be controversial. It used to be that you could not get a liver transplant unless you've been off alcohol for a good 6 months. And those criteria have changed because studies have demonstrated that people actually do pretty well when they get a liver transplant, even if it was from active drinking. But the selection criteria is very strict. They're not going to give livers to people who don't want to stop drinking, or who can't stop drinking, or who don't have the social support, or who have mental health problems that prevent them from being able to take care of the new liver that they get, because getting a liver is a big deal. They don't just give them out, and you can't just take a liver and go home and be fine. You have to take immunosuppressing drugs for the rest of your life. You have to have close follow-up. There's a million complications and other things that can happen, especially in the short period of time when you first get the liver, and that they don't just give them out lightly. They're not growing livers in a lab quite yet. So you have to meet strict selection criteria, and it's very hard when you're very ill and you have no social support, or you're still drinking, or you don't have the mental insight to stop drinking, or you failed a million times in the past to stop drinking. For these selection committees to give people livers. So it turns out that it's something like less than 2% of people who come in with severe alcohol-related hepatitis actually get a liver. But those 2% that get them, they do pretty well. So it's not an absolute contraindication, but it's still pretty hard to get a liver from alcohol-related liver disease. So let's go back to our patient for a second, because this is how the story ends. She, if you remember from this long discussion, she's a young lady. She came in with alcohol-related hepatitis. She was drinking a fair bit of wine for a long time. and she was yellow and her numbers were going in the wrong direction. So we treated her. We calculated out her discriminant function, which is what you do to figure out if someone's mortality is high, and her number was through the roof, and we started her on steroids. So we gave her the steroid treatment. Nothing really happened. Her numbers did not improve. We tried to get her to eat. She did not want to eat. She felt sick all the time, like she had the flu, which is that cytokine release that you get with alcoholic hepatitis. We tried to give her nocturnal feeds. We tried to give her protein shakes. We allowed her to bring in food from the outside that she might find more palatable than the hospital food. I don't really care if she's eating McDonald's and Burger King all day, as long as she was eating something. We tried everything, milkshakes, what have you. She didn't want anything. We had the psychiatric service see her to see if there was some severe underlying depression that was causing her to not want to eat, but they found that she had capacity and they couldn't really force her to eat either. We talked about starting her on medications to stimulate the appetite, but unfortunately most of those were contraindicated with her severe liver disease. We offered her a nasogastric tube to kind of force feed her through a tube in her nose while she was not eating, because that would help quite a bit, and she refused it. And we you can't tie someone down and force feed them when they have mental capacity. That's not really ethical or humane. So we couldn't do that. And despite all of our best efforts, she continued to decline. Her bilirubin started rising even further. She was very deeply jaundiced. She was more and more depressed. She was not eating. We had her evaluated by a transplant service at one of the larger hospitals in the area, and they found that she was not a good transplant candidate because of all these issues. She was in poor health from her liver disease, which again is not a contraindication, but she was declining rapidly. She had psychiatry see her, and they do like a psychosocial evaluation. They found that she had no real support system and no real coping strategy. And after all that, she was still refusing treatment and didn't want to be transplanted anyway. So even though we offered her this transplant and this evaluation, she kind of like declined it, which was, again, unnerving. And it's not what you normally would expect in someone who is dying from a disease that could be cured with a transplant, even though it's hard to get. We had psych reevaluate her, and they found that she has the capacity to do whatever she wants. She was mentally intact. Her liver disease did not affect her brain. Her ammonia levels were fine. She didn't really have much family around to kind of help with this decision process. She never got the transplant. She became more and more yellow. Her liver failed, and she died. And that's kind of the ultimate ending of the story. So she walked into the hospital. She was drinking a ton. She turned yellow. She was in the hospital for about a month. Treatments didn't work. She refused everything. Psych saw her several times, and she eventually died of her liver disease. So it's a scary case, and the reason why I spend so much time talking about this is because people don't always realize that it just takes, in the right person who's a little undernourished, who isn't really eating well, who isn't taking care of themselves in terms of their protein intake and all these basic things, and is drinking a lot more than they should, but not as much as you think, 4 to 5 glasses of wine perhaps. Maybe she was one of those people who had a little genetic susceptibility to the damaging effects of alcohol. Maybe she was telling us that she was drinking 4 to 5 glasses and she was drinking 2 bottles a day. But whatever it was, she was functioning in society and had a job a month or 2 ago, and now she's dead. And that kind of just brings to light how scary these alcohol-related liver diseases are. And in certain people, they can kind of come out of, seemingly come out of nowhere. And before you know it, you turn yellow, and without aggressive treatment, and sometimes even with aggressive treatment, there is no treatment besides transplant, and you're lucky if you get one. So how do people die from alcoholic liver disease besides the situation that we just outlined here? Well, there's a few ways, actually. Commonly, people develop infections. They develop ascites, which is fluid in the belly. That fluid gets infected. They can get a total body sepsis type issue, or they can get kidney injury related to the infection, and you go to kidney failure. You can get kidney injury not related to the infection, just related to the severe alcoholic hepatitis, and you can go into kidney failure and die that way. Gastrointestinal bleeding, you can develop varices very acutely when you have very high portal pressures from the alcohol-related swelling in the liver. And the issue there is that you can bleed from these large varices and you can bleed out. It's a very dramatic way to go, but it happens. And then also acute liver failure, which is what our patient died of. The liver stops functioning, your bilirubin continues to rise, you stop making clotting proteins, you start building up ammonia in your body because you're not able to break down all these toxins, and you slip into a coma, the pressure inside your brain goes up, and you die. So there's a lot of ways to die from alcohol-related hepatitis. There's not a lot of treatment. It's very limited. It's hard to get a transplant. It's very hard to get a transplant, even though it's considered a treatment. Steroids work occasionally. Abstinence and nutrition is the best. And even better than that is avoidance. So prevention and avoidance. So if you're drinking a lot, if you find that you don't have control over what you're drinking or how much you're drinking, or if this case sounds like a loved one that you know, or a friend or someone in your family that's drinking too much to the point where it's a big problem, hopefully this helped to solidify some of the things to look out for when someone is really in trouble and when to bring them to a hospital. And if this is a problem that you struggle with, there is help out there. It's not easy to stop, but there are places that you can start looking for help. And the tragedy with alcohol is that it's everywhere. It's available. It's socially acceptable. It's socially encouraged often. But there is a time when you can drink so much that it actually is too late. And the damage to your liver is irreversible, and a spiraling effect occurs, and despite the best treatments, you can still die. I will link a few resources in the show notes if you're looking for a place to start getting help. And for everybody else, that's the end of this episode. I hope you enjoyed listening. I hope you found this information informative. These last 2 episodes have been a little more on the serious side, and we're going to lighten it up maybe in a week or 2 and do some fun cases. But once again, these topics are important, and it's what we see in real gastroenterology. It's not all about leaky gut and candida and other things that you see on the internet. People have these kind of problems too, and real doctors have to treat them, and we like to treat them because hopefully we can help people through these problems. If you have a question, if you have a comment, please find me on social media at RealGIDoc. You can go to the website, you can leave me a question. I'll put the links below. And until then, I'll see you next time. Thanks for listening.
That's it for this episode of The Real GI Doc Show. Make sure to join Dr. Gandolfo next time to explore another interesting topic in gastrointestinal health. And remember, the views and opinions presented in today's episode are for informational and entertainment purposes only. Nothing discussed in this episode should be considered or used as a substitute for medical advice, diagnosis, or treatment. If you're experiencing a health issue, please consult with a doctor or a medical provider in your area. Thanks again for listening to the show.